Board of Health. Hillard Bosky, member of the Board of Health. Please note, this is a remote participation meeting, and that's due to Governor Baker's March 12, 2020 order, which suspending certain provisions in the open meeting law. Their instructions of how to participate on the town website, if that's helpful for anyone. So why don't we start with attendance? Mary, are you present?
Here.
That's a yes?
Yes.
Okay.
Present.
Deborah?
Present.
Charlie?
Charlie's sitting with me here at the table. He is
Great.
present.
Eric, we know, is not here tonight. And our director, Bruce Murphy, is here.
Correct.
That's great, everyone. Welcome again. So first item, as usual on the agenda, is the public comment. And we'll see how long the line is. Anyone in the public have any questions or comments?
No, I hadn't received any, and I don't believe any came in through the mail, or Kyle might have told us that earlier.
Okay, we'll march right through that then. The big one tonight, of course, is number 2. We'll start with the update of coronavirus, and Director Murphy put together some statistics for us to take a look at.
Okay, let's see what we have for slides available here. That would be just 1 second. We'll post them up.
Are you up, sir?
Yep, you can put the first one up.
Enclosures?
Yep, agenda enclosures, yeah. That's me.
It says it's sharing. You are screen sharing. Can everyone see the posting?
Yeah.
Yeah, but nothing's coming up though.
That you are sharing your screen. I don't know why it's not working. I apologize. I could stop sharing and start sharing again, but it went through to it.
Okay,
Well, that's great.
there we go. Now we just, do I just scroll down from
I
there?
believe you're allowed to, you're a co-host. Can you make that happen?
No, it's
All
not.
right, then I'll be happy to do
All right,
that for
so we
you.
keep going. That's, yep, keep going. Yep, keep going. Okay. Yep, that slide right there.
Perfect.
Good, Mr. Chairman. What we have before us, the board, is the overall cases that we have. And that was based on last Friday, which this graph shows. If you can just scroll down just a little bit more, just to get the bottom of the graph, one little right there. The graph shows 153 overall positive cases that we've had. Currently, at that time last Friday, we had 1 active case with 149 recovered and 3 deaths that were listed at the top. So that's the cases that we have as of Friday. I guess we'll go down to your chart, Mr. Chairman, if you'd like to explain that one.
Right, as usual there. The blue vertical lines are the new positive cases. And those are just the PCR testing. These are not the antigen testing, which are becoming more common, and we're seeing more positives. So that's something we haven't decided yet how to record. So once again, it's just it's the initial test that we were using. And the orange line is an average of every 7 days is a calculation. Now, the big news is really yesterday there were 6 cases. Today we had 1. And previously we've had a previous day with 6 cases, and we had 1 with 9 cases. That goes back to May. Maybe Director Murphy, you can just tell us something about Sunday's cases.
Correct. Do we want to go back one screen to the screen before this, the green screen? So we can see board-wise how we had the big uptick when the coronavirus really took hold in the end of March, and then April, then into May before it leveled out. Then we went down to the summer, and we even went a few days, a couple weeks without any cases during the summer. Then we've always had 1 or 2 cases, 3 cases per week. We have had a uptick over the weekend of approximately, and today we had another case, so approximately 7 cases in the last 2 days. A couple of them are tied to a church in Hyannis that we're working with the town of Barnstable on now. That is something we started working on last week. So that is something that we've been in close contact with myself, the director, and their nurses since last Thursday. We do have our VNA contact with them. We have the state contacting tracers also assisting. So we had several cases out of that. We have all the other cases are not associated with each other that we can find right now. It's still a community spread. So we're looking at that, but that will increase our overall cases. So I will be getting more specific with that probably back to the board later in the week. So
Excuse me,
Yes.
do we know if any of those cases are related to other towns' cases?
Yes. So Barnstable, where the church is located, is receiving the majority of the cases. We're working on a number of family and a number of cases, and children within 3 town school systems. They're in Barnstable school system in YD with we're not sure on all the case locations yet. That's what we're working on.
So we've had a school case now?
We do have, DY does have 1 school case. I'll jump into that as on the agenda right now then. Yes, there is 1 case within the DY school district. I think that was noted in the paper today, Cape Cod Times today. And we also have a case within St. Pius school also of that. And I've worked closely with the principal at St. Pius, and they have notified the student and the close contacts there, and they have sent out a letter, and none of those children that were close contacts appeared in school today, which is good.
Anyone else with some questions about it?
How about the teacher?
The teacher was not in school at all today either. And the close contacts with the, in this particular case, with the student in the classroom or contact, several of those students were not in school today as close contacts.
Do you know what they're doing with the students? I mean, you're talking about a 2-week quarantine, so It's tough.
No, I didn't. I did not discuss that with the principal today, so I don't know if they're on home learning or not.
Yeah, it's tough for the teachers as well.
Yes,
I mean, so far, I don't know if we can really come to any conclusions in town of where
correct.
cases are coming from or a trend. It seems early. Across the country, it seems to be a lot of cases from small gatherings. It seemed to be one of the major causes for the increase in numbers. And then there are certain, I guess, college campuses that are also have increasing numbers.
If we could go down 2 screens.
Yeah, we may have a couple sheets of statistics to take a look at now.
Okay, this, if you want to go over this, Mr. Chairman, just the age breakdown based of last week.
Yeah, interesting. We're not seeing it's the kids local in school, obviously. We don't have a lot of cases as of the 22nd. And we're listing 4 cases only.
Correct, and I think that's going to change as we get into some of these new cases are in the younger grades that were positive. We're looking at the middle school, so this will be updated during this coming week as we do further contact tracing.
Yeah, you just have one student slipping through, and the statistics would change dramatically with just one case. So we'll see. Anyone else? Any thoughts on looking at the statistics there?
So I am in contact with our school nurse. So she's our lead nurse. So she contacts the other school nurses to keep an eye on attendance and some potential families that were working with Barnstable on the contact tracing, and those students were not in school today. So we're tracking down whether the students are close contacts or have been tested themselves. So we're compiling that information today and tomorrow. It's ongoing.
Yeah, it's been interesting. We haven't seen that many households where everyone in that household gotten sick or turned positive for whatever reason, which I was surprised at.
Bruce, I have another question. We haven't seen the chart showing the breakdown of cases by town on the Cape. How are we doing in terms of numbers of cases? Are we
will
getting to the top?
No, let's go to our next sheet. Here's the cases by town. They don't have the numbers by town, but they just do it by color code. So right now, as of last Friday, we were the lowest group as gray. We had been gray, but we did go up to green the week before, but we were back down last week. When they look at the state looks at the incidence rates over a 2-week period. The other towns have been up even higher, down in Chatham and Howard, but they're down now. Nantucket was up to red, but they're down to yellow now, and Barnstable was at yellow at a period of time. So overall, that's townwide where we sit. So we're in a good shape right now. I think with these new cases, we'll definitely go up to green and possibly yellow. The cases come out on Wednesday, the case reporting by the state.
Thank you.
If we go to the next sheet, this is the Yarmouth statistics, and you can see it by week where we've been the lowest, gray, 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 couple greens, gray, green, then we're back, giving us our total case count up top. I think the interesting thing, do I have my, here we go, is on the side here is total tests that we've had. And we can see as of now, as of last week, there's been 542 people tested. And then in the last 2 weeks, there's 1,100 people have been tested. So it's averaging about 500 people a week in Yarmouth are being tested. Some of them are in the health care facility where they're getting tested on a frequent basis, working in either extended living or nursing homes. They're on a regular testing basis. Some people that work in the healthcare field and in colleges and education are tested on a regular basis also. So I think if you take that and look at our positive percent, it's less than 0.5% that after testing becomes positive, very low percent. The bottom of the chart just kind of gives you what's happening countywide, their total cases, because I know we like to look at where do we sit countywide at the 1,900, and the total test for the county down at 97,000 overall test. So I think that's something that we track this chart, and we develop this chart ourselves and maintain this on a weekly basis.
It's getting more difficult to interpret these tables only in that there is more testing and there are different types of testing. So I think we need to discuss at some point how to record this or how to understand it. That's all.
And that's true, Mr. Chairman, because I think what we've seen some towns off Cape is they've get a big spike, and that spike could be where they go from a certain color, gray to green or yellow or red, and that spike came from a nursing home that might have had 5 or 10 cases.
Right.
It came from a few places that have jail or correctional facilities in town that becomes a spike. So it's something the state's looking at as, you know, if your whole town is doing fine, but you have one spike in a particular area, how to try to distinguish that separately, or at least note that, how does that plan into your community spread if it's something to consider. So I think we'll be hearing more on that.
Yeah, good
I
point.
thought it was interesting in the Globe yesterday, there was an article about United Healthcare's sending out COVID testing kits to their Medicare Advantage patients
Oh.
who request them. And I guess they've sent out 160,000 odd cases now. Going to be interesting how that factors into all of these testing numbers.
Right.
They may have also some medication for the flu if they're
Right,
diagnosed.
Tamiflu. Yeah.
Yeah.
Okay, so we could go down to our next one right here on the agenda, Mr. Chairman, if you want to lead into that, or?
Yeah, I think we could use a little history. I know it was an alcohol violation in 2 places, right? One was the tavern at 731, the other was the Moose Lodge, right? So
Correct.
this is a little follow-up on that.
Correct. This is the recent one, violation letter for reconsideration from the Alcoholic Beverage Commission. They Tavern 731 and the Moose Lodge had a violation, COVID violation. They were both closed. Their license is indefinitely suspended until they refiled a new COVID plan that the ABC would look at and then issue a reversal of order. This reversal of order is for Tavern 731, in which they reviewed the information presented and decided and reconsidered and reversed their order and allowed the 731 to open based on October 20th. I received a copy of this. I contacted ABCC and asked them what evidence was presented that allowed them to reopen so that we could go in to check to make sure they're still in compliance, or would ABC send in their own inspector? I have not heard back on that, but ABC did allow, after their review of both places, the Moose and 7/31 to reopen. So 7/31 had been closed the last probably month or so. And what we heard that was based on staffing concerns. So we have reached out to we will be reaching out to the owner to work with them on their reopening.
And what about the select board? How are they involved in this process? They're the ones who issue the licenses, so.
Right, they issue the license, whether they would hold a separate hearing. I'm not sure what their status is, or are they just following the ABCC suspension? And I believe in both cases, the licenses were reissued. It did not require a selectman meeting to reissue the license. So I don't believe they've taken any additional action.
Okay, thank you. Oh, what else? I see safe trick or treating. I see on the agenda, there's a schools reopening. So where are we?
Yeah,
Chairman?
we kind of covered the school reopening, or really school issues under the charts and graphs.
Okay,
We're working with the DY and the St. Pius. So I think that probably brings us down to voting. And I guess we wanted to put that on there as we discussed, Mr. Chairman, that voting here at Town Hall right now is working well. They have separation distances when people come into Town Hall. There's markings on the floor. There's some markings outside if it gets too long. There's hand sanitizer available, and the clerk's office is doing a good job with the voting, that people can feel comfortable coming in voting at Town Hall.
yeah,
There
I
is a
stopped by.
Go ahead.
Yeah, I
There's a
looked
drop-
at it. I thought
outside,
doing a great job.
hopefully.
We're handing out two different color pens, the ballot, and some glue, actually. So we, with great instructions of which side to sign on, which color ink, and actually sealing with a glue stick to close up before handing it back. And the staff they're behind plexiglass, and ballots were going in the box, and yeah, went very smoothly there.
So we just wanted to put that as a reach out to the general public on that. I know the town clerk gave an update to the selectmen last Tuesday, how the voting was going also. So she expressed how the numbers are and the overall operation.
Everyone had a mask on. Police officer was there,
Yes.
and hopefully everyone votes.
Yeah.
Okay. As usual, it's complaint time. Director Murphy.
Yeah,
how-
complaints, we're still receiving some complaints, not as many as we had before, from 1 or 2 a day. We're down to probably 3 or 4 a week now. The typical complaints are people not wearing masks, either going into a store or the people working in a store are not wearing a mask. So we've talked to several stores, reminded them to post it on the door, which they're doing better now. We're checking, we had a couple come in over the weekend, a couple repeat ones that we need to work with this week on the mask. No family gatherings. We had not any issues with family gatherings over the last week. Social distancing seems fine. I have looked at the athletic fields at the school. Friday, I was over there watching field hockey play. Everybody, both teams had masks on. All the home fans on the side, Yarmouth fans had masks on. And with the conference DY's playing in, only the home teams are allowed to show. So everybody had masks and was social distancing there. Saturday, I looked at the game up at Old Townhouse Park, which was DY was the visiting team to Sturgis. Again, boys soccer, everybody had masks on, and masks were on the parents and fans on the side, along with a sign about social distancing. What I did notice at Homer's Park during the game, the playground there was quite a few people on the playground, and depending on the kid's age, there was not a lot of mask wearing on the playground area. So I have reached out to Jeff Colby about putting some more of our mask signs that we have up, our larger metal ones. I think one had possibly been removed. So I think we can probably put up 2 or 3 signs right there.
What's the status of the bathroom there? Yeah, do you know?
Bathroom's closed, but they have 2 porta johns.
Yeah, okay, so functional.
Yes, yes. So that's a busy place. They can be that Old Townhouse Road, they can have 2 soccer games going at once. So, I mean, they got 2 fields up there, so it can be a busy place with a busy little playground in the middle.
Yeah, I've seen some adult teams playing there without masks over the weekend.
Yeah, Sunday, sometimes they have adult pickup in soccer. I have reached out to the rec department. It's not a scheduled, but it's a pickup game. So I mentioned out to them, hopefully we're going to have to put the sign up, or somebody will have to go by and kind of remind that regular pickup group that they need to have masks on.
What happens? Do they have to book the field? What, or is it just absolutely pickup?
I think it's absolutely pickup, but it's one group that's pretty much uses it Sunday morning. So they can be reached out to.
With some very good players. Watching.
Yes, it's college, adult, very good soccer players.
What's the status of football at the high school?
That's in winter. They don't start until early spring, so I think they start practicing like February.
Okay,
Don't play until March, so it's going to be weather conditions. I'm not sure that's going to be more of a challenge, being outside in the cold and snow. I think it's more cold and snow then than when they play maybe in November. So we'll find out.
let's switch sports. What's the status for basketball then?
That I haven't heard. That I haven't heard. That's supposed to be a later inside. I haven't heard how that's going to go. I have heard on volleyball they're going to wear masks, and the front line goes back to about 3 feet behind the net, so there's no front to front on the players. So I have been in touch with our athletic director, discussing that, and along with the school principal.
And Director Murphy, you want to address the sport of wrestling?
The what?
Wrestling, that's going to be a tough one.
Wrestling. That's even a tougher one.
Okay.
So now
Down
we
to
can get
Halloween
down
and
to,
Thanksgiving.
Yep. Well, we go to Halloween trick or treating. We did include some information in the packet. I did share this with the public in the newspaper. There's been a couple stories that had gone out last week and will be going out this week. This was just highlighted back from one of the stories that the person was writing, that I just mentioned, that if you're trick or treating, still practice social distancing, face coverings. Obviously, if you're not feeling well or waiting for a test, you should be staying at home and not going outside trick or treating.
Bruce, did that drive-in situation come about?
That the drive-ins having a spooktacular on Saturday, and that's sold out. I think they're at 220 cars.
Wow.
That will be a trunk trick or treat where the people come in, stay in their cars. The kids can stay in their cars. The Chamber of Commerce will be bringing around candy to each of the cars to give to the kids. They will have the portable camera, I believe, from the drive-in going up and down the aisles to the cars to show the kids in their costumes, and that will be shown up on the the 2 jumbotrons. So that will be exciting for the children to do that. They can stay in their cars or in their little pod suites that are staying up there. And,
Got 40 volunteers now.
yeah, okay, they're up to 40 volunteers. I know they were looking for volunteers, so that's good. They got plenty of volunteers for parking, passing out bags, and monitoring the suites. So it's a great partnership between the chamber and the drive-in facility. So I think, and then they're going to show the movie Hotel Transylvania, I believe it is.
And the rec.
And it was the rec department?
Oh, very highly.
Yeah.
involved.
So.
Great.
Just one thing to keep in mind, that the Halloween masks don't provide the same protection as the mask that everyone's wearing.
Correct.
So it may be having two masks on actually, so.
Yes, depending, and then some of the masks that are designed have designs on it too. Some of the COVID masks that you wear have designs, so.
That's great.
Yeah, we can't get Charlie, but he's got a nice flowered one. He's all ready for his flower get up, his Halloween Hawaiian.
Our child.
He's got a Hawaiian outfit.
With a cape on or not?
No cape yet.
Okay.
If you could scroll down a little bit through the trick or treating, Miss Zoom. And we have a couple other things that just were points of interest. Yeah, we can keep going. You know, people should stay away from haunted houses, gatherings. I don't think we have any going haunting houses or hay rides or gathering this year.
Mhm.
So, and I think we also have an event at the Witter Museum. They're going to have a little something for the kids out back also. That starts, I believe, at 1 o'clock, 1 to 4 or 2 to 4. And they're going to have some events out there for, I think it's a small fee to get in. And they're going to have activities for the kids and a little walk out back. So we've been working with them on that event also. So holiday celebrations coming up just shows a couple different types of masks to wear. And we keep going by, it talks about same type of people need to be concerned about spreading the virus over the holiday and taking precautions, whether it's gatherings and so forth. Okay, I think the biggest one that we'll probably be talking about is, that we'll be hearing more about is Halloween. After Halloween is obviously Thanksgiving. That's the tough one when all the kids come home from college and everybody's sitting around the table elbow to elbow. What precautions need to be taken, whether the kids coming in and on family gatherings. I'm not sure they might be as large as before. So I think that's some information. I'm working with a couple other towns on putting some general information for people together out there.
It's even having family members and friends who don't live with you, coming from other towns, other states. It's not just if you have, you know, kids who are, you know, at school. Pretty challenging. You're sitting close to close, you're eating, that means there's not a mask on. It's cold, windows are, you know, closed. This is a difficult one. You know, I would encourage people to perhaps have smaller gatherings if they're going to have them. I don't know if I have a great answer to this. Anyone else? Any thoughts on this?
I think the best thing is to just have your own small group celebrate Thanksgiving, the people that have already been together through all of this, and not expand your bubble just to celebrate this holiday.
Yeah, because I mean, the majority of the, you know, people are probably not people who you're living with,
Right.
whether it's to have an extra table there to spread people out, you know, having people bring food as opposed to everyone in the kitchen next to each other. So if anyone's listening, just, you know, think about it. That's all. It's really it's a tough holiday for what we're trying to work with here. So.
And there's no other really outdoor activities that day, Thanksgiving, where usually sometimes there's the football game where people would be outside for a while, and there's always a few road races that are fundraising for food events. So I think you're seeing less of that this year. So unfortunately, people will be staying in the house. So people need to consider taking precautions.
If it's, if it's a warm day and it's not raining, you can spend some of the time outside. Bring the chairs and go outside. So anyway, I wish everyone luck with it.
Okay.
I think we're up to number 5 on the agenda, and that's an update on the flu clinic. Director
Okay.
Murphy,
Yeah, we'll
anything
call that up.
specific?
We're still partnering with Cape Cod Hospital, Cape Cod Healthcare Pharmacy, 7 days a week. They're available by appointment. You can see it on the screen here. Monday through Friday, 7 a.m. to 7 p.m. And then on weekends, 8 to 4. Call for an appointment. They do have the high dose vaccine. When I talked to them last week, they got a shipment in. So you can call and make sure if the shipment's still there. I know that's been a hot commodity. I know Barnstable is looking at having a drive-through clinic coming up, I want to say next week. And they do not have any of the high dose for their people they're going through the drive-through. But as of now, they do have it at the hospital. I think it's worked out well. I haven't talked to the hospital recently of how many Yarmouth people have gone through. I have talked to several that have gone through, but it gives a lot more flexibility for residents, along with attending any of the pharmacies that we might have in town, and one grocery store that offers the flu shots. So it's available out there to get. If you're looking for the high dose, I think you have to make a few extra calls, but the vaccine is available.
Just reminded everyone, the high dose is for people who are 65 and over, and those who are immunocompromised in some way. And October is probably the best month to get vaccinated for the flu. And everyone should be keeping in mind, we have 2 infections that are going to be spreading at the same time. Okay, number 6, we've got some turn-in for unwanted medications. Apparently the police station had opened up their lobby for 4 hours this past Saturday. Since COVID, they haven't kept the lobby open for that, is my understanding.
Correct.
And it may be that way for quite some time, just as a safety precaution. So keep an eye on the website for the town when they're doing it again, and whether you're following on Facebook. And until it happens, you have medications at home, keep them safely. That's all. And
Correct.
we really don't want it flushed down the toilet. You can throw most medications, in the garbage. Generally, I tell people to mix it up with coffee grounds or put it in with, old milk or something, just so someone else is not going to be interested in taking it and using it, including animals at home. Director Murphy, you want to skip on to number 7 for new and old business?
Yes, under new old business, we did monitor Cumberland Farms, West Yarmouth on their tobacco violation. They did serve their suspension. They had removed their tobacco product. We did monitor that at the beginning and at the end, and our inspector Phil went out there and they were in compliance with the removal. So that worked out well. And that's all that I have right now, Mr. Chairman.
Anything coming in for building?
Building remains very steady. The real estate market is very steady out there, which has a lot of septic systems being upgraded. So we're working with in the engineering companies. We're booking up probably 2 weeks out on booking for a test pits and perk tests for new septic systems. Very busy with engineers' plans coming in. We're probably running a good 2 weeks to get a plan review, 2 to 3 weeks. So that's working out okay. We're still seeing some additions coming in, house renovations. So that's the big ones. We're working on The DPW building up on Buck Island Road, that septic system is in the process of being installed. So we've been up there talking to the engineer on site. On Route 28, Yarmouth Gardens Motel, you probably see the fence across the front of that. It's across from the water park. That's the one the town's working with the developer. They should be taking that one down. Demolition within the next probably 1 to 2 weeks, so they can start construction. They're hoping that fall, the fall on that. So we're working with the engineer. We had a second site visit out there with the engineer. We needed some minor groundwater elevation monitoring, and the plan updated on that. So we just received that plan, so they should be proceeding with that fairly quickly.
Okay, anything else you can use from the board? We can help you?
No, I think we're doing well. I think the drive-in finished up last weekend with their last event. I want to say all the events and the movies went very well this summer. I think the setup that we looked at, the pods and the suites worked out very well with the staffing and the security staff that they had. I think they did a very good job up there. And I know they're looking at hopefully coming back next year and be working with the selectmen on negotiations for that going forward for next summer. I think they're hoping to work with the selectmen over the next month to get that finalized.
Okay, thank you. Before we wrap up, just the board appreciates all the help from the Zoom tech team. Thank you.
You're so welcome.
Okay. Let's do something else. Anyone want to make a motion to adjourn and we can finish up?
I move that we adjourn.
Second.
Good.
Okay.
Charlie was ready to do it. He
I thought he
he didn't have the speaker
Ready,
in front of
Bruce,
him. He was
was
ready to
trying to
go.
save you.
Yeah.
Okay, just raise your hand, everyone, if you're saying yes to this.
Yep. Charlie's agreeing.
Okay, that's done. This meeting is adjourned. Thank you, everyone. Stay safe.
Thank you.
Thank you.
Good night.
Night now.
Bruce, with all this social